This film is about an extraordinary development programme aimed at assisting Iraqi doctors, nurses and policymakers to rebuild their healthcare system. The planning started 5 years ago, and the programme was launched in 2007. Since then, over 350 professionals have come to the UK, spending up to 8 weeks updating their clinical skills and learning about change management. They have come from all over Iraq, from all clinical specialties and administrative functions, male and female. For the doctors and nurses, the programme is about developing insight and self-confidence to recognise the skills they have, as well as providing ideas on what is possible. Above all, it is about developing their ability to become agents of change. Let's go back to the beginning for a moment and discover the trigger for the development of the programme.
The key trigger was when Dr. Bill Kirkup, the Associate Chief Medical Officer, went to Iraq, and Bill came away with a vision of how the department might be able to support the reconstruction.
There wasn't an awful lot of effort going into providing one of the main shortfalls, and that is all of the clinicians that I met, very committed, very good, excellent knowledge, very keen to practice, to train and teach, but awfully conscious that they'd been cut off from the rest of the world for about 20 years. The number one priority, I said, was to contribute to updating those skills.
After design of the programme, the next big step was selection of the candidates.
We were very tough in our selection, and every 3 months we have meeting. We discuss every single CV of every candidate, and also we discuss each personal statement, and those statements indicates what does the candidate want to learn, what his vision from learning.
The clinical placement of the participants forms the sort of bulk, if you like, of the program, because they spend 6 weeks in NHS trusts.
They were highly motivated individuals, and they were like sponges. They wanted to see so much and pack it so much into that 8-week period. It was just a fantastic experience for all of us.
They can go to operating theatres, ward rounds, outpatients, clinics, anything that they are interested in.
The NHS has shown itself to be magnificent, both in hosting the Iraqi clinicians, but also being willing to learn.
From our clinicians' point of view, is they came across a group of doctors who've actually worked in very difficult circumstances and had to learn to innovate. And in the ways that they innovated their care in Iraq, we could translate some of those methods for our practice. So many of our doctors did say they learnt things from their colleagues from Iraq. And then secondly, it made us appreciate what we already had.
We saw these people as change agents, and to change things you need to know how to do it.
The general approach was about integration of various aspects, integration of learning about change at personal, organizational and system level, integration of learning about change in Iraq and NHS, integration of various developmental approaches such as supporting consultancy, education, training, coaching, and bringing in different tools and techniques.
Yes, and we used a different range of tools and techniques, one really helping them analyse the need for change and how to actually plan the change, and the other tools and techniques were around engaging stakeholders. And often through the programme we'd actually take time out to run simulations so they could put these things into practice. At the beginning, we had a period of induction where we helped the participants with tools and techniques that they could take out to the NHS clinical placement, where they could analyse change that had happened and learn from the way in which clinicians and managers had made that change. We visited them in the clinical placement, and then the last few days of the programme, we devoted that to converting their NHS experience into a series of very practical change projects which they would take back to Iraq. And they presented them to an expert panel right at the end of the programme.
Yes, and the expert panel included people who were representing NHS, people who are experts on health system development from this country, and not least their own contributions. Their contributions of the peers helped to analyze the projects for change and make them better. Initially, the clinicians were very resistant to learn about change because they couldn't work out what it has to do with them as clinicians. However, very early on, and with each cohort we could see the change that happened to those people, and they started recognizing that they could initiate change in their system, that they could support others in bringing that change to fruition.
Most of our citizens, our people, constructed their thinking constructed to just to obey command, not to positively share in decision making. What is needed, as I think, is not just education, but developing to use tools and elements of change management efficiently and to make the change planned, not emerged.
In fact, we met one or two of them recently at a conference and discovered that they had become coaches themselves.
My colleague came to me and tell me, I want to make a project of a speech therapy center. I will give you my lecture about change management. Go to these steps. What change you want? Why change you want? What is your plan? And what is the objective? And what's your vision? If these things clear for you, okay, make a study, and I will go with you to the policymaker, minister or minister assistant, and I hope both of us, we convince them.
About 80% of the candidates applied their projects.
It was the range of the projects that I was surprised. These are all clinical doctors, and they are clinical doctors working in hospitals. And yet, the projects span the whole spectrum, from public health and prevention to clinical practice and to systems development.
This training course inspired our mind to think in many projects to change the current status and to improve the healthcare in our country. These projects will carry a great impact on the patient and the use of resources.
Some of the participants, they returned and to present here to their peer groups and to the stakeholder conference what they had actually achieved. They surpassed our expectations. It was fantastic. And to feel that they actually gone there and made such a huge difference to what it was there before.
Dr. Nizar Shawki is a specialist physician in diabetes. He participated in the programme in autumn 2008 and whilst in the UK developed a project on diabetes education for patients and other healthcare professionals.
In Iraq, current situation for change management is there is no plan for solving a problem. You just have to solve it. As a diabetologist, I was interested in seeing a center for diabetes. If you are a doctor back there, you can see an outpatient clinic about 50 patients a day within 8 hours. When it is come to 50 patients a day, you don't have time to educate the patient about their disease. So I started a program about educating the patient for his disease. Then the program developed more, upgraded. We managed to educate 96 primary health workers, and we managed to educate about 231 health providers and paramedics about the diabetes through a monthly based courses. What we have achieved up to now, with us or with our colleague, is to put your thinking of solving this problem on a paper, read it, organize it, and go step for step. Changing attitude and becoming more organized, finding a problem and know how to solve it in a scientific or in an organized way, scientific organized way. And that's what happened through this course.
There is no question that all of those who've been involved in this program have recorded it as a major success.
This is the idea of one of the candidates who participates in the training. He said, we learned how to deal with facts, to think and to write a project, how to analyze the plan and to implement the projects, how to assess the result and correct the pitfalls, how to become an agent of change.
Actually, you have made some changes in our mind, and I would like to tell you finally, you can depend on us for making change in the future. Thank you very much. Thank you for your attention.